Hi, my name is Amanda Mabin, and I'm going to be talking to you about the Lecithin-Sphingomyelin Ratio. Lecithin is the most critical alveolar surfactant required for postnatal lung expansion. It is detectable in the amniotic fluid at approximately 21 weeks and increases in volume around 24 weeks. Sphingomyelin is the pulmonary phospholipid that remains constant in amount. When the ratio of lecithin to sphingomyelin reaches 2:1, the infant's lungs are considered mature. This occurs around the middle of the third trimester and marks the ability of the baby's lung to function at birth. This test would be used on a gestational diabetic mom at early term if the baby is getting too big. This would cause more glucose to cross the placenta, increasing the glucose levels of the baby. When glucose levels are too high, the baby makes less surfactant. It would also be indicated in a pregnant woman with chronic glomerulonephritis. This test is performed before a planned procedure, such as an induction of labor or a C-section, if prior to 40+ weeks gestation, to verify the presence of adequate lung surfactant. Use of intrabronchial synthetic surfactant may be indicated to treat respiratory distress syndrome in a newborn. Decreased maternal placental flow, as seen with maternal hypertension, placental dysfunction, infection, or corticosteroid use, can increase fetal lung maturity. This increase in maturity is a result of fetal hypoxia that puts stress on the fetus. The increased fetal stress increases blood levels of corticosteroids that accelerate alveolar and surfactant development. Another indicator of fetal lung maturity is if the amniotic fluid is positive for phosphatidylglycerol, or PG. This has also been related to the absence of respiratory distress syndrome.